almost discharged a patient this week, and guess what? There was a very sudden change in his condition, and he died quite suddenly. So what's this video about? Let them change at their own speed. We admit patients to hospice, and generally they're feeling ill, they're not comfortable. As they're coming on, they have a lot of symptoms. Perhaps they've had a trip to the hospital for decline in their illness. They fell, they were severely injured, they had surgery. It doesn't matter, but whatever it was, and we've already talked about how we determine if someone is appropriate for hospice admission, so that's not what it's about. But remember, I've said we are really good at managing symptoms, hospice is. So the patient gets admitted. They have perhaps severe pain, shortness of breath, they're nauseated, they can't eat, maybe they have dementia and they're extremely agitated. So we wave our magic hospice symptom management wand, and hopefully in a few days or a few weeks, they feel much better. They start to climb up that condition hill. And or else we were able to stall or slow their downward trajectory. We can see them on this lovely plateau of comfort. Perhaps they're not getting any better, but they're not getting any worse, and they're better than when they admitted. So after a while, the team starts to think, Mrs. Smith might need to be disenrolled from hospice. Even though she still needs care, she's better than she was on admission and just doesn't look terminal right now. So what to do? Well, this is what happened to me this week. I had a cardiac patient who was relatively stable. He had been comfortable for 6 to 8 weeks after we got all the extra fluid off his body. We treated his chest pain and shortness of breath. He was going out with his wife for drives and even walked out to the mailbox. Everything really was smooth for about 8 weeks. I was just about ready to raise my hand and talk to the medical director to review the case and consider discharge. Well, all of a sudden, just this week, there was no new insult or problem with medications, no new injury, but all of a sudden his body just said, I can't do it anymore. He became suddenly weak, he couldn't walk, he had shortness of breath, no appetite, some increased confusion, and in a day he had died. His heart finally had just given out. We were all surprised. So what's my point? Let the patient change. Give the patient a chance of the full certification period to see which direction things will go. Make sure that they're comfortable. Let them be the leader in your approach to individualizing their care. Be patient. Let nature take its course. Walk with them. Be observant. But also be ready for these sudden changes that aren't expected. Sometimes we just can't tell. And be gentle with yourself. Be supportive of your team if things change suddenly and no one could have predicted it. And of course, be incredibly supportive to the family who hadn't the benefit of a slower transitional decline to process that anticipatory grief, and then all of a sudden things changed. Get your team involved. Invite the social worker and the chaplain for bereavement visits. We in hospice care learn to be flexible and roll with the changes. Know they may come when you least expect them, and take a lot of deep breaths when they do. Please watch our videos. We're passionate about hospice care. We want your patients to meet the standard of the 4 C's. Let them be calm, comfortable, clean, cared for. And don't forget our motto, care is always the best treatment.